Third presentation about radiological anatomy of the brain by Professor Sharaf and revised by Professor Rami Edward, will be concerned with basal ganglia and the internal capsule. The basal ganglia are a group of gray matter nuclei responsible for integration of movement. What are the pathological processes that can occur due to pathology in these nuclei, in these basal ganglia? We have Huntington chorea, we have Parkinsonism, we have Wilson, and of course you know that Parkinsonism is the disease with tremor at rest. What are the basal ganglia? We know we have three groups: corpus striatum, substantia nigra, and subthalamic nucleus. Corpus striatum is formed of, again, mainly two big basal ganglia groups, the putamen and globus on one hand, and the caudate is in another hand. The putamen and the globus are called together the lentiform. So the corpus striatum is made of the caudate and lentiform, and the lentiform in turn is formed of putamen and the globus pallidus. Substantia nigra are some nuclei seen in the located at the midbrain, and then we have the subthalamic nuclei. This is the location for the red nucleus at the midbrain. This is the arborization or the orientation of the different basal ganglia. In coronal section, if you see this one, the frontal horn of the lateral, one of the lateral ventricles, body of the lateral ventricle. The one adjacent to that one is the frontal, and the mainly frontal is the caudate nucleus. Away is the triangular component of the lentiform, which is formed of the putamen and the globus. And here is the amygdaloid, which is the most medial of the hippocampus. Don't forget that we have commissural fibers like corpus callosum and anterior commissure, and we have projection fibers like the internal capsule on either side. Here are the basal ganglia. So this one is related to the frontal horns, is the caudate nucleus head. This is the putamen and this is the globus. Caudate, putamen, globus, and don't forget that what you are seeing here is the head of the putamen, head of the caudate, but it has a body and tail. The caudate nucleus is like this. So here is the globus and the putamen, and here is the caudate, and here is the tail of the caudate ending at the amygdaloid nucleus, and the amygdaloid is the most medial part of the hippocampus. Remember that the amygdaloid is also responsible for some voluntary abnormality, epilepsy. So these basal ganglia are responsible for controlling movement. Now coming to the diencephaly, which is formed of the thalamus, hypothalamus, and epithalamus. As the name implies, epithalamus is above and is related to the pineal glands, which secretes the hormone melatonin, while the hypothalamus is below and is related to the pituitary stalk and ossipituitary. Mammillary bodies process olfaction and other sensory information, control reflex eating, while the infundibulum is a narrow stalk connecting the hypothalamus to the pituitary gland. So the structures of the hypothalamus lies below the thalamus. The diencephaly corresponding to a large extent to the lateral third ventricle, structures around the third ventricle, the thalami. What is the internal capsule? This is the frontal part of the internal capsule is different from the posterior part. The frontal part of the internal capsule contains fibers or lying is in between the thalamus and frontal lobes. And the fibers connecting the basal ganglia and cortex. So it contains fibers from between the thalamus and the frontal lobes and fibers connecting the basal ganglia and cortex. The motor fibers in the genu of the corpus callosum are called the geniculate fibers. What is the geniculate fibers? It is the genu of the internal capsule. The anterior two-thirds of the posterior internal capsule, anterior two-thirds of the posterior internal capsule contains cerebrospinal fibers from most areas of the cortex. So any lesion in the posterior limb of the posterior capsule, mainly the anterior part, anterior two-thirds of the posterior limb, is more dangerous. The posterior third contains sensory thalamic fibers and optic radiation and acoustic fibers, so it is concerned with vision and hearing. The anterior limb of the internal capsule separates the head of the caudate nucleus from the putamen, while the posterior limb of the internal capsule separates the putamen from the thalamus. So the orientation of the internal capsule is as follows. Anterior part between caudate and putamen, posterior part between putamen and thalamus. The anterior part is concerned with fibers from the thalamus, from the frontal lobes, connecting fibers, while the anterior two-thirds of the posterior internal capsule is responsible for the motor affection, because they are passing the cerebrospinal fibers from the motor cortex. The posterior third is responsible for sensation, for optic radiation, for acoustic fibers, and that's why it is different. So the posterior limb of the posterior capsule is more important if affected than the anterior limb of the internal capsule. Where it lies, the anterior capsule, between the putamen and the caudate. Where it lies, the posterior limb, it is between the putamen and the thalamus. Here it is. If this is the caudate and this is the lentiform, that part is lying between both putamen and caudate, and that is the posterior limb lying between thalamus and putamen, or thalamus and lentiform. In these three images, we are lucky to see the region where the vein of Galen lies. It lies here, the superior cerebellar cistern. And we have two lines here. These are the two internal cerebral veins. So remember that there is big cistern behind the third ventricle, and is called the superior cerebellar cistern, or the cistern for the Great of Galen, and it is related to two small structures, linear structures, called the internal cerebral veins. This is a low ventricular level, or the low ventricular level is a smiling face level, where we have the quadrigeminal cistern looking like as a face, smiling face, resembling a mouse. This is a Sylvian fish, of course. And here we have the internal capsule, anterior horn of internal capsule, anterior horn of lateral ventricle, and this is the anterior limb of the internal capsule geno. But this is another geno, which is the geno of the corpus callosum. Remember the thalamus. So between the thalamus and lentiform is the posterior limb. Between the caudate and lentiform is the anterior limb, and there is a geno of the internal capsule. Then you have to know pineal bodies, pineal gland at the posterior part of the third ventricle. You have to know the choroid plexus, the cerebral veins lying in the cistern for the vein of Galen. Of course, this one is the straight sinus. Now collectively again, two internal cerebral veins lying in the most upper part of the cistern for the vein of Galen, or the large superior cerebellar cistern, and then we have the choroids, we have the geno of the corpus callosum, we have the splenium of the corpus callosum. Now we left the region of the internal capsule and basal ganglia, and this is called the old dancer level or the high ventricular level, and this is the region of the corona radiata. High ventricular level or old dancer level. What is this? This is a falx. What is this? This is superior sagittal sinus, and this is the straight sinus. Occipital lobe, parietal lobe, frontal lobe, body of lateral ventricle, which extends downward to be temporal and backward to be occipital and anteriorly to be frontal. Now this one has another orientation for the same area. Old dancer with the Sylvian fissure, because the angulation here is different than that in CT. We give the splenium of the corpus callosum, geno of the corpus callosum, septum pellucidum in between the two lateral ventricles, falx cerebri, superior sagittal sinus, frontal air sinus. This, you just remember that this term now, it is the superior frontal gyrus, and remember that medial one, which is called the cingulate gyrus. We'll use these terms after. And another one is the central sulcus. So the center, in the center here, that one in the middle, central sulcus, and that one in the medially is the cingulate, and that one anteriorly is the superior frontal gyri. So these are superior frontal gyrus, cingulate gyrus, central sulcus, the biggest sulcus along the middle of the parietal region. If you look here, the ventricle starts to be away from each other. This is the old dancer level, so this is the recent dancer level, and this is old dancer level. This is the recent dancer level. They are not touching themselves, each other, while this is the old dancer level. That doesn't mean except that we are in ventricular level, high ventricular levels. Most high is the recent one, recent dancers, and the least high is the old dancers. As you are seeing here, the ventricles are getting away from each other as you are going up. Now this level is at the region of the ventricles. It is a high ventricular level. They are becoming away from each other, and there is the corpus callosum splenium, and there is the geno of the corpus callosum, and this is the falx cerebri, frontal lobe. Of course, this will be the superior frontal gyrus, and here the site of the central sulcus. And if you look medially, this buckling is due to the cingulate gyrus. Posteriorly, you have the superior tertial sinus, of course, and occipital lobes. Now, this is a high level where the dancers are getting away from each other, the ventricles are away from each other. Don't forget that still we have corpus callosum. So the corpus callosum, splenium, and genome are now coming to each other as a one mass, and this is called the corpus callosum body. The lateral ventricles are there with choroid plexus inside, and this is the falx cerebri, showing the dense straight sinus inside. Here in this one section touches the upper portion of the body of the caudate. This is the caudate, and this is part of the caudate touching the frontal horns. Remember that the big sulcus on the parietal region is the central one, and the frontal one is the superior frontal gyrus, and that buccal area is the cingulate gyrus medially on either side. Now we are at a very high level here, and then this small horn, lateral ventricle, frontal lobe, parietal lobe, falx cerebri. Here is the falx cerebri, straight sinus, superior sagittal sinus, lateral ventricle, splenium, and septum lucidum. This is in the level of the corpus callosum, of the body of the corpus callosum. Anterior we have the geno, posterior we have the splenium, but at lower levels. Parietal lobe, parietal lobe up, extending upward. The occipital lobe is just the area between the occipital horns and the falx, but not here. This is parietal, this is high parietal. As you see, the level is taken here, high parietal. Here we have, at the level of the thalamus, just a revision. What is this one? It is the superior sagittal sinus, occipital lobes, choroid plexus, internal cerebral veins, starting here and going out, going anterior, internal cerebral veins, frontal horn, thalamus, internal capsule. The posterior limb is more dangerous than the anterior limb. Anterior 2/3 are concerned with motor activity. Posterior third is concerned with vision and hearing. Where is the putamen? Caudate. The putamen is here, and the globus pallidus is here, and the caudate is there. So this is the whole thing about basal ganglia and internal capsule. Thank you.